Good afternoon, everyone. Today I'm going to present about association of antihypertension medication with retinal nerve layer and ganglion cell in the placebo layer thickness. Glaucoma and hypertension are chronic and prevented conditions, and the relationship between blood pressure and glaucoma is complex because of the presence of multiple interacting factors. Diurnal variations of IOP and blood pressure could result in decreasing ocular perfusions in certain individuals. Some research suggest that more aggressive treatment of systemic hypertension significantly lowers the risk of cardiovascular comorbidities, although this could have significant implications for optic nerve perfusion, particularly in patients who have glaucoma. Different classes of antihypertensive medication produce varying effects on the patient blood pressure profile. Previous studies have suggested that there may be an association between blood pressure and glaucoma, but they did not take into account the effects of co-parenting factors, including the use of antihypertensive treatment. Therefore, the reason author conducted the research to evaluate the association between different classes of antihypertensive medication with retinal nerve layer and ganglion cell in the placebo layer thickness in a non-glaucomatous multi-ethnic Asian population. These findings may have important implications in determining which classes of systemic antihypertensive medications are more suitable for patients with glaucoma. This year, a population-based cross-sectional study, there was 9,144 eyes for retinal nerve layer analysis and 8,549 eyes for ganglion cell in the placebo layer analysis aged from 44 to 86 years from the Singapore epidemiologist of eye disease study. Participants in this study underwent standard systemic ocular examinations and interview questions for collecting the data on medication. IOP is traced by Goldman tonometry and OCT imaging performed using circus AD, OCT, and blood pressure were measured using an automatic blood pressure monitor. Now we will move on to the results of the research. A total of 4,699 participants was included. Of them, 48% were male, and the men's age were 58.8. Participants taking two or more times medication were significantly older than participants who have one medication or no medication. Among included participants, 64.8% were not taking any form of antihypertensive medication. 18.6% were taking one-time medication. 16.6% were taking two or more types of medications. 11.1% were taking angiotensin converting enzyme inhibitors. Subjects who require one or more time medications were most commonly given medications of calcium channel blocker and beta blocker. And this average retinal nerve layer thickness was 92.4 micrometer, and the average macular ganglion cell in the placebo layer thickness was 80.3 micrometer. The use of any antihypertensive medication was significant also with the thinner average retinal nerve layer, and a greater number of antihypertensive medication was also associated with the thinner retinal nerve layer. And you can see here the P was smaller than 0.001. analysis of a scientific types of antihypertensive medication found that the use of angiotensin converting enzyme inhibitor and diuretic were significantly associated with thinner retinopathy layer. There was a similar change was noticed in the studies when analyzing the macular ganglion cell in a placiform layer thickness. Authors divided the antihypertensive medications user groups into subgroups of treated and well-controlled hypertension and treated but unwell-controlled hypertension for comparison with non-hypertensive medication users. And they observed that antihypertensive medication users, whether have a well or poorly controlled blood pressure or have a significantly thinner retinal nerve fiber layer and ganglion cell in the placiform layer thickness, compared with individuals who not take antihypertensive medication. There were also no significant difference in retinal nerve fiber layer and ganglion cell in the placiform layer thickness between treated individuals well-controlled or poorly controlled hypertension after adjusting for risk factors. So in conclusion, the use of truth among antihypertensive medication, especially angiotensin converting enzyme inhibitor and diuretics were associated with a loss of structural markers of retinal ganglion cell health in a multi-thickness Asian population. Thank you for your attention.
Thank you very much.